I'll talk about the risks of vasectomy for a few minutes.
One of the risks is that you'll later decide you want a pregnancy and you'll be unable to reverse the vasectomy. The reversal surgery is unsuccessful in about at least 10% of cases. So the vasectomy could be very permanent. Another risk is that we can't complete the vasectomy today. The shape of the scrotum for some men makes it very difficult, and there is about 1 in 500 guys who does not have a vas deferens on both sides. Will likely know that I'm unable to complete the vasectomy today as we get started, and we'll talk about your options at that point. Another risk is chronic long-term pain, what we call chronic post-vasectomy pain syndrome. Older studies say about 1 in 250 guys will have this. I do an open-ended vasectomy, which may decrease the risk below 1 in 250. The open-ended vasectomy is described in my bigger video, but basically it means that I leave the end of the vas deferens that goes down toward the testicle open. This relieves pressure on that end of the tube, and we think that pressure is responsible for most of that pain. Having that open end does mean that you may later develop what we call a sperm granuloma. Sperm are expected to get out that end, and sometimes guys have a reaction to that, forming a little pea-sized lump. That is the sperm granuloma. This generally happens between about 1 week and a few months. They are non-painful and don't cause any problems, but be aware that you may develop that. They may take several months to go away. Another risk is of swelling, and what I'm talking about here is the swelling that's related to a hematoma, a broken blood vessel inside the scrotum. These happen within the first day, and I would want to hear about them if you think you might have a hematoma, and we'll talk about this more, this caution more when you come in for the procedure. The risk of a hematoma is about 1 in 50 is what studies say. My risk is about 1 in 150 guys that have a hematoma. Another risk is allergy. Also, infection is a risk. There's a small risk of failure. After you've had your 2-month, if you've done your 2-month semen analysis and it shows a low sperm count, the risk of the tubes growing back together again is about 1 in 3,000. So the risk is very low, but it does exist. Another risk is that there will be a change in appearance or sensation of the genitals. For example, you could have a small amount of scarring at the scrotum. Most guys would have a hard time finding this scar. Thanks for listening to this. When you come in with me for the procedure, I'll have you sign the consent form that goes over these risks in writing and give you the chance to ask questions about them if you have any.